Hello everyone, this is Dr. Rukmani Choudhary and you are watching Dr. Rukmani's Health Update. My today's topic is paresthesia. Medically, we call it like paresthesia in needle or pricking sensation, and we call it like loss of sensation, loss of feeling that you don't feel anything in your leg and feet, and there is a tingling sensation. So today's topic is all about this, and I'll be discussing all the causes behind it, like what causes, what contributing factors. There are certain common disorders, some rare disorder, autoimmune disorders, and what are the tests required, diagnostic criteria, and best effective homeopathy medicines and treatment in allopathy. To watch complete video for complete information. If you're watching first time, please like, share and subscribe my channel. Paresthesia, it can be like in your hand and in your feet, and there can be several causes behind them, and the basic cause is that your nerve injury. Of course, your nerve is responsible for the functioning of there are kind of like motor neurons and there are sensory neurons. Motor means movement, so certain nerves are responsible for the movement, and if it is the damaged one, then this is like there is a paralysis. We call it like paralysis, so you don't able to move the affected body part. On the other hand, if it is like of sensory neurons, there is a damage in the sensory neuron, and then that is for the feeling purpose, so you don't feel anything, there is a loss of sensation. So that is why the proper nerve functioning is required. So in today's topic we'll talk about this neuron, and the basic thing that the bottom line is that your nerve is damaged, and this can be due to several reasons. Diabetic neuropathy. Nowadays diabetic is the commonest cause for like neuropathy. In diabetes you have peripheral neuropathy, means your hand and feet's nerves are affected. So high blood sugar level is always damage your neurons, your nerves. So if you are diabetic, so just have a good control, fair control on your blood sugar, so you don't have any bad effect and your nerves are like they are in a good health. Vitamin deficiencies. Vitamins are also required for the proper functioning of the nerves, neurons, and these are like vitamin B1, B6, B12 and even vitamin E, and these vitamins are responsible for the proper functioning. So if you have deficiencies of these vitamins, obviously your nerve functioning is affected and you have tingling, numbness feeling in your hand and your feet. Now if you have if you have nerve injury after any accident or injuries, if there is a pressure on the nerves, then this ultimately leads in the numbness. Carpal tunnel syndrome, I already uploaded video on that. The carpal tunnel syndrome, median nerve is damaged and there's a first 4 fingers are affected and you don't feel anything, so there is a paresthesia, numbness and pain. Certain autoimmune disorders, and these are like rheumatoid arthritis and multiple sclerosis. I have already uploaded videos on all these kind of disease, so you can watch the autoimmune disorder. So I have listed out all these disease. Rheumatoid arthritis can be there, multiple sclerosis can be there, and there are certain kind of infections like Lyme disease, that is a kind of bacterial infection that damages your nerves. This also causes nerve damage if it is a chicken pox like varicella zoster virus and it is in the dormant state, and once it is awakened, so in that case this causes the nerve damage and the numbness. HIV, if certain disorders like hypothyroidism, in hypothyroidism you also have like numbness, myalgia, vasculitis. These are certain conditions, but they can cause numbness and tingling. Now the examination part, how we examine. Physical examination is required for the diagnosis part. Complete physical examination, neurological examination, your reflexes are checked, that your motor and sensory reflexes are checked, and complete medical detailed history is taken, that what kind of symptoms are you having, is there any pre-existing condition for any problem. So ruling out all other medical problem is required. Your blood tests are conducted, your certain functional tests, your organ functional tests are done, kidney function test, liver function test, hormone test, chemical test, vitamin test, that which vitamin is deficient, electromyography is done, nerve conduction test are done, and in advanced cases like in the nerve biopsy is done. Treatment part. The crux is that we have to find out the underlying cause. You cannot treat paresthesia or numbness superficially, that you are having numbness, you don't feel anything and you are having the random medicine. No, it is not required. The crux is that we have to go to the underlying cause, that what causing this, whether you are having diabetes or you are having any autoimmune disorder, or is it a case of like carpal tunnel syndrome or after any injury. So we have to find out the main cause, the underlying cause, and treatment is completely depend on your underlying cause. So this is allopathy. You are given, like if it is a case of diabetes, diabetic management should be done, and there are over the counter drugs, like if you are having pain, so there are medicines for the pain. If it is a case of vitamin deficiencies, you are given like vitamin supplementation. So we have to find out the main cause. Homeopathy, again, it's a kind of individualization and holistic approach. These medicines you can find in the description box below. All the medicines link are there because these are homeopathy medicine only available on homeopathy pharmacy or homeopathy store or homeopathy doctor's clinic. That's why I provided all the medicines link in the description box below. But don't buy all the medicines, and the place you belong, the medicine, the color can be changed, or the form of the medicines can be changed. Like it can be in the tablet form or in the dilution form, but it doesn't matter. What matters is your medicine name, the correct medicine name. Califos is given when you have numbness, there is a paresthesia, and particularly for the fingertips, and along that you have weakness, there is a poor circulation. So in that case you can use Calphosphoricum. So the color can be anything, but the medicine name is Calphosphoricum, and you can even find this medicine in the dilution form or in the tablet form. If it is in the tablet, just have 2 tablets twice or thrice before having your meal, and if it is in the liquid form, just take 1 or 2 drops, same thrice in a day before having your meal, and just have it like regularly 2-3 weeks onwards. Dr. Rukmani homeopathy medicine. This is for the poor blood circulation. Like if your circulation is insufficient, you are having low blood pressure, and you are having paresthesia, numbness, prickling. So in that case, you can use R67. I have already uploaded a separate video on R67. So this is in the dilution, in the drop form. So just have 5, 10 or 15 drops in some water, and just have it before having your meal, like twice or thrice in a day before having. This is having multiple medicine in it. So if you are using this medicine, just try to use the single medicine. And if you Calcarea carbonica, so Calcarea carb is the medicine that is used if you are having numbness, tingling. Difficult, you cannot grasp the things, so in that case you can use Calcarea carb, and your constitution is you are like fatty, fair and flabby, and particularly for the female cases we prescribe Calcarea carbonica. Use lesser quantity of the medicine and start with the lower, like 6, 30 and 12 or 30, these way. Folia, spondylitis, you are having pain in the nape of the neck, and you are having pain in the shoulder. So in that case you can use Paris quadrifolia, and numbness of the hands and the feet. So same way, just have 1 or 2 drops with the help of dropper, and just use like twice or thrice in a day before having your meal. Phosphorus is given when you have numbness and tingling, and that is in the morning time. So morning time you are having like numbness, you are having tingling kind of sensation. So in that case you can use phosphorus. Silesia. Silesia is given when you have the same symptom like numbness, tingling, but at the night. So at the night you can use Silesia if the symptoms are aggravated during night. So just use Silesia. Is given when you like is a case of pinched nerve, or you are having nerve injury. So in that case you can use Hypericum. This is in the tablet form. So just have 2 tablets twice or thrice before having your meal regularly, and this also comes in the dilution form. So if you are having dilution form, just take 1 or 2 drops, same twice or thrice. It's the chart. Causticum is you have carpal tunnel syndrome. Causticum is very good, and you are having cold feeling in the tips of the finger. So in that case you can use causticum in 30 or 200 potency. There are other medicine as well depending on the patient's underlying cause, disease history, complete case, other medical problems. So hopefully you are finding this video knowledgeable and informative. If you find this video informative, please like, share and subscribe my channel. Press the bell icon to get notified. Thank you for your time. Thank you for watching. Keep watching, keep supporting. Thank you so much.